Hello, my name is Tyler Koski. I'm a neurological surgeon and the director of the Neurological Spine Surgery Program here at Northwestern Medicine. Today we'll be treating a patient with a complex spinal deformity related to Parkinson's disease. So please join me inside the OR. Our patient today has a kyphosis, which is a bending forward posture. It's related to Parkinson's disease in this instance, and a phenomenon called camptocormia. Essentially, he cannot stand up straight, which is quite disabling for people. What we're doing today is the start of a two-step process of standing him back upright via a fairly complex spinal fusion operation. Our patient is in the supine position or face up because we're actually going through his abdomen today. The benefit of going through the front is that we don't have the nerves in the way. I can put a much larger spacer in through the front than I can through the back. We'll bring him back secondarily to do an operation from his back that involves a much bigger surgery with screws and rods, reconstructing his spine to allow him to stand up straight again. Dr. Rodriguez and the vascular team have opened up the patient's abdomen to expose the spine. They've protected the blood vessels and gotten all of the organs safely out of the way so I can do my part, which is to take out some of his lumbar discs. And I'll build that height up by adding some spacers in there and a few screws to stabilize that. So today we're working on the lumbar spine, where there are 5 lumbar segments with discs in between them. The bones get numbers and the discs have to share. So I'm removing the L4-5 disc, which is in between the L4 bone and the L5 bone. The discs are generally like shock absorbers and cushions and allow motion in the spine. But when they get really degenerative and collapse, they can be painful. And in this case, they're not supporting the spine enough to stand upright. So this is the device we're going to place. This is a relatively small sized cage. It's made out of a material called PEEK, stands for polyether ether ketone. It's a biocompatible plastic and it has a metal front where we'll put some screws through once we get in there. So it's going to go in like this into the disc space. Okay, mallet please. Good. So it goes in with a little bit of force, but that's because we want it to be nice and tight in there because it is not supposed to move around. Put a hand on the top, please. I'm going to place 2 spacers today to really stabilize the disc space at the bottom of his spine, where we'll put the screws and rods in his back, which will hold him in position and really gives him a very nice solid foundation to build this entire new alignment that we're going to build for him. Okay, so that implant is done. So when people cannot stand up straight, we call it a sagittal plane imbalance. It is extremely disabling. So they can't go very far without some type of assistive device. They get significant back pain and they fatigue really quickly, so it's difficult. But when somebody starts to collapse over as much as this, we actually start to compress some of the abdominal organs. And he was having problems with eating because he'd get full after just a few bites of food because his stomach was so compressed. So that was a big problem that we're gonna correct by giving all of his organs more normal room as well. We just took an x-ray. The implants that we placed looked great. This little dot you see back here is the back of where that spacer I put in. It's made of a plastic, so it's radiolucent. So they put a little marker so I can tell that it's in safe position. And then you can see the metal plate that was on the front and then the screws we put into the bones to hold that in position. So the overall alignment change, it went from shaped like this to now shaped like this. So since the x-rays look good and we've confirmed everything is in position, now we can call the vascular team back in to start the closure process. Once they close him up, he'll go off to recovery for the next 2 days. Then he'll come back down for the next stage of the surgery, which will be the much more extensive posterior approach from the back, from all the way between his shoulder blades, all the way down to the bottom of his spine to really build him that new, stable, aligned spine.
Wait till you see on Monday. Yeah.